Today we are going to be discussing the world of lobbying with Ms. Erica Sword. Erica is a registered lobbyist for the American Lung Association and has been advocating for public health on the Hill for 10 years. We're going to be looking at what an average day is like, what the process takes, and how she takes on big tobacco. So good morning, Erica.
Good morning,
Thank you for
Samantha.
joining us today. So let's begin with bringing us inside the Capitol building. What is the average day in the life of a lobbyist like?
Well, the average day doesn't always involve the Capitol. A lot of the times with the use of email and other work to make sure that constituents are communicating with their members of Congress, we're either on the Hill or back in our offices or in coalition meetings with partners.
Interesting. So do you mind if we do a bit of a rapid fire question about what this actually entails?
Sure.
Okay, so what is at stake when you go to the Hill, or when you're...
Tobacco is the leading cause of preventable death in the United States. Over 440,000 people a year die from tobacco use. And that translates to about 1,200 people a day. And so it's our goal to put into place public policies that work to reduce tobacco use and to educate members on what it will take to reduce this leading cause of preventable death. Tobacco is also a tremendous expense on our public health system and on our economy, totaling up to about $200 billion a year annually in healthcare costs and lost productivity. So there's a lot at stake. There's a lot of work to do. The tobacco industry's pockets are extraordinarily deep, and they have a lot of resources that they can throw, including campaign contributions to members of Congress. And so the public health community needs to mobilize the American public to communicate that we can no longer allow big tobacco to continue the way they have.
And so what are particular provisions that you are usually trying to work on?
Well, there's a whole host of different tools that can be used to reduce the tobacco footprint in America. And so we certainly communicate about the importance of tobacco taxes, on helping smokers quit and putting into place policies that do so, and also making sure that the FDA, the U.S. Food and Drug Administration, has the authority it needs and the resources it needs to effectively oversee tobacco products.
And so what impact would such provisions have on, say, public policy?
Well, those are public policies. All of those issues are a part of our public policy agenda, and those are ultimately what we work to advocate for and educate members about the importance of.
And so what are you usually up against in terms of lobbying, like in terms of the political interests of the tobacco industry?
Well, I mean, their job is to continue to addict and sell their deadly product, and our job is to counter that and to make it known that tobacco is a pediatric disease, that the majority of people who start using tobacco are well within their youth and don't understand the consequences of a 12-year-old decision that it has on a lifetime. So it's our role to make sure that the tobacco industry is held accountable for its work, and that it doesn't have free will in terms of U.S. public policy and U.S. and in general the impact on our nation.
And so what are some of the other big opponents that you face?
Well, the tobacco industry and other people who profit off of tobacco sales. And so I'm not sure I would couch it in an opponent's type of language, but there's certainly other interests that care about tobacco sales, and they're certainly vocal and very present on the Hill as well.
Do they include tobacco growing states?
Well, it's hard to have a state advocate in that way. There are different interests that a state moves forward with. So there's certainly lawmakers from different states that have different priorities than we might hope for. But it's our job to still talk with them about the importance of implementing effective public health policies to reduce the burden caused by tobacco, both to the American public, to their constituents, and to the taxpayer.
And so when you're dealing with such a big industry, how do you put together a team on your side?
Well, ultimately, the American public is our team, and we know that people who have lost loved ones to tobacco use and people who are struggling to quit, people who have successfully quit, people who don't want their kids to start using are our most effective storytellers and our most effective advocates, and that's one of our jobs as people who work on behalf of public health to make sure that constituents are communicating that message to their members of Congress.
And so, as an advocate for the American Lung Association, you worked on getting the Family Smoking Prevention and Tobacco Control Act of 2009 get put in place, which gave the Food and Drug Administration authority to regulate the manufacture, distribution, and marketing of tobacco products to protect public health, correct?
Yes.
Okay, great. So that bill took over 10 years to become a law. What kind of effort went into that process?
A tremendous effort, and that it was really a long time in coming. The Lung Association worked for close to 20 years to ultimately get FDA to have that authority, but the efforts on the Hill were most pronounced for about 10 years. A tremendous amount of working with coalition partners, a tremendous amount of educating lawmakers, a tremendous amount of strategizing, a tremendous amount of working with our congressional champions and our administration champions on that. And ultimately, the American people had their say. We knew that there are a tremendous number of the American public who wanted FDA to have this authority so that tobacco products couldn't claim to be less harmful, that the companies were no longer preying on kids without any sort of accountability, and that they couldn't manipulate their products to make them more addictive, and to continually come up with new products to hook new users.
So you mentioned coalition partners. Could you explain a little bit what that means?
Sure. I mean, we certainly know we don't have the deep pockets of a tobacco industry or even the other corporate interests on Capitol Hill. And one of the ways that nonprofits especially work both to increase the echo chamber, but also to maximize everybody's expertise and skills and resources, is to work closely with partners, and that is something that that we certainly did. Ultimately, over 1,000 organizations endorsed the legislation that would give FDA this authority, the Family Smoking Prevention and Tobacco Control Act, and it was through that wide bipartisan broad support that ultimately the bill became law.
So you had 1,000 organizations, you said, like working together to get this done, and I mean, you have the facts behind you, the evidence is clear. Tobacco and smoking cigarettes causes cancer, so why did it take so long?
There are a lot of different interests entrenched on the Hill, and there were certainly a lot of hurdles to overcome. And we knew that hostile Congresses in past years had made it impossible to have the bill become law in 2004 when we had our other best chance to do that. So we continued to plug along and to bring along new supporters, and because of the champions in Congress on the Senate side, Senator Kennedy and Senator Dodd, and were instrumental in the ultimate passage of the law. And on the House side, Congressman Waxman was the lead Democrat on the bill there. But there was tremendous bipartisan support as well. So that was really critical ultimately for the support of the passage of the bill.
How do you deal with particularly like fence sitters, like people who are on the fence between both sides?
Well, there are a lot of black and white issues when it comes to tobacco control, and ultimately the point needs to be made that this is, I think, generally educating people about what is in a bill, why it's important, and that there are a lot of people whose votes they want that are ultimately counting on them to do the right thing. And ultimately, I think a lot of the things that we do here need to be supported by constituents back home in order for something to be successful.
Do you ever communicate with the tobacco industry at all?
We do not speak to the tobacco industry.
Okay, so solely to
our champions and to all members of Congress.
Okay, and so how do you advertise for this cause?
We don't advertise. We do not have a budget to do that, and so, but we certainly communicate, and there's a difference. And we use a whole kind of toolkit that we have of tactics to ultimately advance our strategy. And so that can be, emails, that can be tweets, that can be a whole host of different opportunities that we have to communicate directly to members of Congress. But what a lot of it involves is just old-fashioned pounding the marble floors in the House and Senate office buildings to talk with members and their staffs, and also to make sure that that our nationwide organizations that are back in home districts and home states are communicating the importance of the legislation that we're advocating for here.
So if you could compare the type of money that goes into like the public health side of the campaign versus the tobacco industry, I know last year alone they spent over $26 million on lobbying.
Well, it's a different perspective and it's a different approach. And you know, we do everything we can with the resources we have, and ultimately more resources makes for an easier job. And I know that the tobacco industry has certainly enjoyed those a lot more than we have.
And so what did this act mean for Americans?
Well, it meant for the first time ever that there was a watchdog over the tobacco industry and the products that are being made to manipulate, to addict, and ultimately to kill them. And that is a tremendous impact on the public health. No longer do we have light and low cigarettes, which were health claims made that ended up with millions of Americans continuing their addiction or starting an addiction that would lead to death and disease.
You said light and low cigarettes? What is that particularly?
Light cigarettes were something that were introduced by the tobacco industry to try to assuage smokers that the products were less harmful to them. Much like a Diet Cola that is probably more dangerous to consumers than even a regular cola. So, you know, I think those facts are still to be established, but what we do know is that light and low tar cigarettes, mild cigarettes, ultralight cigarettes were used to particularly target and addict women. But ultimately became 85% of the market, and we know that the majority of people were under the impression that those products were less harmful to them, and ultimately what happened was instead of getting lung cancer in your upper lobes because you had to breathe more deeply, it ended up in your lower lobes, and it caused even more death and disease than had we just been subjected to the regular cigarette. So this industry created light and low tar cigarettes because they knew that there were concerns about quitting, and they lied to the American public, and indeed the cigarette industry, a number of companies have been convicted by a federal judge on civil racketeering charges as a result of the light and low tar fraud and deception.
Wow, so while in this case you had hard facts to support your cause. You, for example, every year tobacco kills more Americans than did World War II. More than AIDS, cocaine, heroin, alcohol, car accidents, homicides, and suicide combined. So, however, do you think all lobbyists have such hard facts to support their cause?
Well, facts don't always matter. A colleague of mine says that Congress governs by anecdote. And so one of the most important things that we can do in the public health community and in the nonprofit community more broadly is to have constituents share their personal stories. Facts only get you so far, but what you need to do is to make a compelling case, and oftentimes that involves advocates sharing their personal stories, real people sharing that they lost their husband or mother or father or grandmother from a tobacco-caused disease, and that oftentimes the person started when they were just very young and didn't know any better. And so ultimately personal stories go a long way with convincing someone to do the right thing from the public health perspective. You need to have the science-based evidence, and that's one of the reasons that organizational reputation is so critical, but that's not going to get you over the finish line.
And so how do you reach out to constituents to get them to share their stories? Sometimes could be devastating stories.
Well, there are always devastating stories when they come to tobacco use. And that's one of the things about a nationwide organization that works to help smokers quit, that works to engage people in other ways, that if they're able to then turn around and share their stories about why it's so important that policy change occurs, then that helps not only empower someone who may have struggled for years to quit, but it can result in policy change that will make it easier for more Americans to not become addicted to tobacco.
And so how do you establish trust in Capitol Hill?
It's personal relationships. It's making sure that you do have the science with the facts behind you, that you're not being deceptive or disingenuous. We don't have the opportunity in working for a nonpartisan organization, we don't make campaign contributions. That's illegal for a nonprofit 501c3 to do. And so what we have to continue to do is to build relationships with Hill staff, to become a trusted resource, and to do what we can to help those offices when they need information from us.
And so does that mean regularly keeping in contact with them?
Absolutely.
So even when a bill like this is not being worked on, just keeping up those relationships?
Absolutely.
Okay, so what do you think the world without lobbying would look like?
Well, this is something that was protected and envisioned by the framers of our Constitution. And when you read the Federalist Papers, it's very clear that groups having the ability to petition their government is very clearly established within the First Amendment. And so I think that, unfortunately, lobbying can have a very negative connotation, but there is a difference between corporate lobbying and lobbying on behalf of the American public, and I think that's a differentiation that isn't always made.
You made a great point there. You know, obviously good comes from the work that you've done and for things such as the Tobacco Control Act. However, in movies such as like Thank You for Smoking, lobbyists are portrayed as schmoozers, people who are paid to talk for a living. And how do you think that we can fix this sort of disconnection with the American public?
Well, I think that we need to continue to do our job and to continue to highlight the good work that our organizations do. You know, I think that when you stop and explain to people that you're a public health advocate, they understand the differentiation. And unfortunately, I think some of the broader misperceptions are going to cloud that. But that's not my primary concern. My primary concern is making sure that our organization's mission is communicated and our public policy positions are advanced.
And so if you could take one word to categorize like what a lobbyist is, besides the word lobbyist, what would you call
An advocate.
Them? An advocate.
An advocate for public health, an advocate for advancing the public policy positions of a nonprofit organization. I think advocacy is very much there, and that's what we're here to do.
So would you say that lobbyists are educators for congressmen to make education?
There's a difference between advocacy and education. There's a legal difference between advocacy and education. When I'm advocating for something, I'm advocating for a position. I am encouraging and asking for a member of Congress or the administration to take a position on a particular issue, the position of our organization. If I'm educating someone about something, I'm telling them the facts. And hopefully the facts will lead them to the right decision. But there's a very, not only nuance in that, but there's also a legal differentiation in that too.
And so what else should Americans know about advocates?
Well, it's important that no matter what you care about, whether it's public health, if it's clean water, if it's clean air, all of these different things, all of us have a responsibility to communicate what we care most about to the people that we send to Washington to be there for on our behalf. We know, right now in the gun control debate that the majority of Americans want stronger restrictions on who can buy a gun and how they can buy it, how many bullets are included in the high capacity gun, but unfortunately we need more people to share their stories with their members of Congress to help communicate that there are a lot of people that, despite their very busy lives, are keeping their eye on the prize.
Well, thank you so much.
Thank
you.
you.
Learned a lot today.
Thanks so much.
Thank you.